Mental health is always an important subject, but now the conversation is more important than ever as the pandemic has had a major impact on mental health. Mike Davis visited the Geriatric Psych unit at Desert Springs Hospital to learn more.
Hey guys, so we're here at Desert Springs Hospital taking a closer look at the impact that an event like a pandemic has on mental health, and that's why we're here with Christopher Bateman and Dr. Zafar. Thanks so much for being with us, guys.
Thank you.
First, let me just ask you this. The impact that we saw of a pandemic over a year, something like that, the impact that has on mental health, can you kind of describe the toll that took?
Thank you so much, Mike, for asking that pertinent question. The challenges that we've faced over the past 18 months have been on multiple fronts. People who were suffering from mental health issues suffered more because of lack of access to mental health care and just the general assumption that they should not go to the hospital because they don't have COVID. But interestingly, people who did not have any mental health issues were the ones who got affected greatly, and they were predisposed to those issues because of certain risk factors, such as poor social support, financing difficulties, housing instabilities, and just in general lack of health care.
Even though we had this massive increase in stressors, what we also saw simultaneously was a decrease in ability to cope with that. So people who used to go shopping or to church or to the gym, these social environments all of a sudden had those immediately shut off, and it takes away the ability to deal with it how we previously have.
If we're trying to look for warning signs, whether it's in a loved one or in ourselves, what are some of those warning signs we should look out for?
So just as Chris said, we really have to pay attention to changes in behavior and changes in baseline. So any changes that are persistent and cause significant impairment in their social and personal well-being are red flags for an underlying mental health disorder. Changes such as changes in sleep, changes in appetite, changes in concentration, changes in the ability to make decisions, helplessness, hopelessness, anhedonia, difficulty focusing, difficulty paying attention to tasks at hand, and even suicidal ideations.
I think when we're looking at those symptoms, it's really important not that we're just trying to see those in people around us or loved ones, but we also look for those in ourselves. We know our own baseline and our own moods better than anybody. It's important not to just wait those things out, because they can get worse if we just ignore them.
Most importantly, the call to action. What should we do if we're recognizing this in ourselves or a loved one? What's the best way to ask for help?
So the message we want to spread out is that social distancing does not mean we must stop supporting each other. Just go with the proverb, charity begins at home. Just be more compassionate and more empathic.
For the past year plus, we've talked about frontline heroes, and nothing has changed even now. We still need heroes, and ultimately the best way to do that right now is kindness. Be kind to everyone regardless. The people we often think don't deserve it are the ones who need it the most.
Guys, thank you so much for being with us. Thank you for everything you're doing for the community and for all this incredible insight. And I'll toss it back to you guys in the studio.
All right, thanks, Mike. And for more information, you can call 702-894-5508 and visit desertspringshospital.com.